Is health reform going to make my insurance more expensive?
It will get more expensive for some people and less for others. It depends.
Depends on what?
Health issues, age, different things.
If it gets more expensive, then that's not fair.
If it gets less expensive for you, but more for someone else, would that be fair?
It's only fair if it gets cheaper for me.
Some of my colleagues say it would only be fair if they get paid better. It's natural to want what suits us.
So what is fair?
Well, what you do think is fair?
Everyone gets what they deserve.
But how do you define what someone deserves?
If I keep myself healthy and don't have a lot of costs, I shouldn't have to pay extra for people who do.
You are healthy right now. And you take good care of yourself, which is terrific.
See?
But some people take bad care of themselves and stay healthy, and others do everything right but still get sick. So it isn't quite that simple.
Most people are sick because they didn't take care of themselves.
What about someone who has MS?
That's not her fault.
So insurance should be about fault?
Well, if a health problem is their fault, they should have to pay for it. If it's not their fault, then they shouldn't have to.
What do you mean by it being someone's fault?
Well, like smokers should pay more. That's only fair.
Under health reform, smokers will pay more. That is recognized as a health choice that affects a person's health costs.
Good.
But what about smoking cessation programs? Should those be covered?
Sure, that seems like a good idea.
But they're costly. Everything you add makes coverage more expensive.
Then only the people who need them should pay.
Isn't that like no insurance at all, if you have to pay when you need it?
I don't know.
People who smoke are more often poor. They sometimes can't afford a program. But the costs to them and to society are lower in the long term if they quit. So should we collectively agree to pay for that and save ourselves money?
I guess so.
But isn't that against what you said was fair?
Maybe it's okay to not be fair if in the end it's better for everybody.
So, sometimes we are talking about fairness and other times we are talking about the greater good. What if we were talking about drug abuse instead of cigarettes?
I shouldn't have to pay extra to take care of people who use drugs.
But what if you're going to pay eventually one way or another, whether it's in insurance or in taxes and prison costs?
That's confusing.
What if someone started using drugs because she was abused, or because her parents used them?
Then it doesn't seem like her fault.
But how do we decide what is someone's fault, or how much fault is enough?
I don't know.
Or, what about alcoholics? Should insurance cover alcohol treatment programs? Or liver transplants for people with alcoholic liver disease?
Well, to get a transplant you have to have quit, don't you?
It depends. Most places you have to have quit for 6 months or so. Is it fair then?
Well, if they've quit then it seems fair.
What's the statute of limitations on this fairness? Would 3 months be enough? 3 days.
Anyway, alcoholism is a disease. My cousin wasn't alcoholic.
Isn't drug addiction a disease?
That seems different.
Because your cousin wasn't a drug addict.
I don't know.
What about smoking? Nicotine is more addictive than alcohol. Usually people smoke because they are addicted, not because they want to.
Well, at some point they made a decision to start smoking.
What if they started as kids, because of cigarette advertising aimed at children?
You're making me confused.
Addiction is complicated. Let's talk about something simpler. What about someone who rides motorcycles?
Those are dirty and noisy and dangerous. They should have to pay more.
What about bicyclists?
That's a healthy activity.
But they can get hit by cars and have high medical costs.
That's different. It depends on if it's a healthy thing or a not healthy thing.
Healthy in terms of reducing actual health costs, or just seeming like it would be healthy generally?
I don't know.
What about skydivers?
That's dangerous. They should have to have special insurance.
Rock climbers? Skiers?
I don't know. Skiers are all rich anyway, they can afford it.
Football. A kid gets hit too many times in the head, and he'll have high costs later because of cognitive problems.
Well, he shouldn't be punished for something when he didn't know better.
But his parents let him, and they know he could get hurt. It was a decision about behavior that resulted in costs.
I don't know.
What if someone has a gene for a bad disease? Should they pay more?
No, that's not fair.
So you're willing to shoulder some of the costs for them, if you're lucky and don't have bad genes.
That doesn't seem quite fair either, that I should have to pay for their bad genes.
But it has to go one way or another. Either everyone shares the burden or they don't.
I don't know.
Should someone older pay more than someone younger? Older people are more expensive.
Well, I shouldn't have to pay more to balance out people who are old. That's not fair.
Your mother is elderly and has health issues. Should she have to pay more because she's old?
No, that's not fair for her. It's not her fault that she's old.
But you can't have it both ways. Some people have things that are more expensive. Either you spread out that expense, or you don't.
Can't we spread it out without making it more expensive for me?
No.
That doesn't seem fair.
Insurance exists to spread out risk. But the question is how much to even out, and which things. Should everyone pay the same, or everyone with the same risks, or only the same controllable risks and behaviors? And how do you decide which factors to adjust on? Is it fair to adjust for risks you can't control, and how do you define control anyway?
I want people to be covered, except if they are doing things I don't approve of, in which case I want them to pay.
So it's really more of a moral thing than an insurance thing?
Also, I want a lot of things to be covered, but I don't want to be part of paying for it.
Ah. So pretty much you want a perfect world in which everyone gets care but nobody has to pay for it, except as punishment for bad behavior.
Yes. Can we do that?
No.
That doesn't seem fair.